This is maybe the most profound change and amazing result I've seen with Invisalign first aligners used for interceptive treatment instead of the commonly used palatal expander. Here we have a girl who is 9 years old, possibly 10, and escapes me right at the moment. But what doesn't escape me is this great result. She came in with a large overjet, you can see on the left, and an extremely narrow arch. I want to point out here that the narrowness was mostly in the anterior region, and that's generally more of a dental narrowing. The width here was a little bit narrow. You can't see the palate, but it was not an incredibly high, narrow arching vault. The patient did not have a crossbite on either side, but she clearly needed expansion, and we got that with the aligners. You can look at the difference if you compare the two. Now, whether this is a skeletal expansion or a dental expansion, it's probably more of the latter. But sometimes the knock you hear would be the occlusion. And if you notice here, the back teeth are in pretty reasonable occlusion here. And this will settle a little tighter once the aligners are not worn full time. And so clearly you don't see any posterior open bite or anything weird. And then on the lower arch, you can see also a broadening of the arch and better dental alignment. And again, on the top, if you look from the front, we've closed the diastema. The teeth don't protrude out as much. And we still have to do a little bit of tweaking here. This was only at the end of 6 months, upper and lower treated together, no palatal expander, no braces. This mom was familiar with Invisalign and trusted my opinion. This patient's older sister also is wearing aligners. And, the excitement about braces when you are a young girl wears off pretty quickly. And some cases require it. But if you can have a chance to have Invisalign, you can get great results without having to have a fixed palatal expander, which is uncomfortable, traps food. Removable is always going to be better. And of course, invisible and better for hygiene. Thanks for paying attention.